Welcome to Cancer Explained with Central Care Cancer Center. It's likely that someone you know has been diagnosed with a form of cancer. Learn more about specific cancers, their risks, signs, symptoms, and treatment options by listening to Cancer Explained.
Hello and welcome to Cancer Explained with Central Care Cancer Center. My name is Leanne Powers. I'm the Marketing Director for Central Care, and with me today is Radiation Oncologist Dr. Perez-Tamayo. At Central Care Cancer Center, we are dedicated to keeping expert cancer care close to home. We have state-of-the-art facilities throughout rural Kansas and in Missouri. Whether you need radiation or chemotherapy, a second opinion, access to clinical trials, financial counseling, or other supportive services for yourself or your family, even genetic screening for cancers, Central Care is here for you. At any time, feel free to email with any questions or comments to askdoctor@cccancer.com. That's askdoctor@cccancer.com. Well, our discussion today centers around head and neck cancers. So, obvious question to start, but what is all included in head and neck cancers? Cancers that is grouped specifically, assuming, of course, through your head and your neck. But just if you could go into more detail, that would be great.
Thank you, Leanne, for having me here. I specifically want to highlight the fact that you mentioned about being surrounded by your family and friends in support, because this area of the body, the head and neck, when needing treatment, is very, very difficult to get through. Highly curable in most cases, but because so many things happen in the area of basically between your lips, starting at your lips, going down to the level of your collarbone. In this area, we swallow, we actually start digesting, we breathe, we speak, and all of this causes vibrations and sensations and things that really impact not only our life quality, but also functionality. So when you have a cancer that is involving, let's say, your lips, and the cancer is significantly enough entrenched in there, and it starts reacting well to the treatment, meaning it starts dying, it basically falls off and it leaves a hole. The hole needs to be filled in by your own body, so you have to eat, even though that eating makes you crack your lip and makes you have pain. And many times these cancers go to lymph nodes that also need to be treated, and those lymph nodes may be what we call mental nodes, or right under your chin or in your neck, which also will make that area sore. So now we have a community of areas that are going to be inflamed, swollen, and painful for the treatment and curability of this cancer that are going to impact your life. And if you don't eat, you can't make tissue, and you can't fill the hole, and you can't get rid of the cancer that is now dead. So getting through the treatment is actually one of the biggest challenges that we have in the head and neck cancers. Now, again, I mentioned to you the head and neck cancers are regional, and they're treated and they have different ways that they behave. They start at the lips, and they go down and involve all the areas of your oral cavity or your mouth, which include your tongue, the base of your mouth, your gums, your cheeks, the palate. Then as you go towards the back, you begin to see the tonsils and the pillars of the tonsils and the back of your throat. Then if you go up into the nasal area, you get something called the nasopharynx, and into the nose. There's also the sinuses, of course. And if you go down from your tongue, the tongue is divided into the oral tongue, meaning the one inside your mouth, and then where your papilla are, or where your taste buds are, back of your tongue is your base of tongue, and it behaves very differently. As we go down, then we have the epiglottis, which makes the food not go down to your lungs. It's kind of a little flap that prevents the food from going down your lungs. And we go down to the vocal cord area, where you have these little triangular pockets called the piriform sinuses, and then you have the vocal cords. And then very much at that point, you begin to see more of a lung, or the trachea, or the windpipe or the esophagus, and it's no longer called head and neck cancers. But the head and neck cancers basically are in that range, and you would think in that neighborhood of regions they would behave uniformly, but they don't. The way that they are innervated, the way that the blood comes to them, the way that the cancer likes to go into the lymph nodes or into the blood is very different. Some cancers like to go back up into the brain region. Some like to go down into the lymph nodes. Some like to paralyze your nerves. And some really very quickly start spreading. And again, it depends on the pathology. So it's just really almost a world of different behaviors and different treatments that are needed for these cancers.
Is there a common type of head and neck cancers? I mean, out of everything that you listed there, from the lips, the mouth to even the throat, is there a more common?
The type is really related to the lining of your mouth and all around that area is very typical, and it's a flat cell. It's called squamous cell. It can also be your salivary glands. That's a glandular cancer. That's not a flat cell. That's a different covering. There can also be sarcomas and lymphomas, but the most typical cancer is a squamous cell. There's the rare cancers, like I said, the adenocarcinomas of the salivary glands. There's the melanomas, for instance, that you would see in the skin, but they could be inside your mouth. They can also be lymphomas, but the most common is the squamous cell. Now, it used to be that most of our squamous cell carcinomas were attributed to smoking. There's still many that are attributed to smoking, but now we see very young people that have head and neck cancers, and I'm talking high school student or above, that are caused by the HPV virus or the human papillomavirus.
Okay, because I was just going to ask you if there's like a specific age even that you see more head and neck cancers in, but it could just be the whole spectrum, couldn't it?
We see them all. We see them from young teenagers to the older men and women. Usually it's the older, not the younger, because it takes time to get a cancer. There are some cancers that are vicious, though, and they can grow very quickly. But HPV is very much directly directed to the formation of these cancers, of especially the tonsil, the nasopharynx, and the tongue. The more posterior tumors, are like the cancers of the glottis or the vocal cords, are more about smoking and how it's hitting those vocal cords.
Is there a common symptom when it comes to these types of head and neck cancers?
Well, yes, because this area is, as I said, so busy that pain is a common problem, and it feels like a cold sore. And it starts like a cold sore, actually.
Okay.
And people attribute it to a cold sore. Maybe it's under your, let's say it's someone that has false teeth, and they have a sore under their dentures, and they think, oh, well, they're not fitting right. Or, for instance, it's a sore under your tongue. Well, maybe there is like a cold sore under the tongue. But it starts, how to differentiate that it is not a cold sore is that it lasts more than a week. If something is lasting more than a week, it is not a cold sore, and you need to see your doctor. Now, when you go to the dentist, now the dentist can't see beyond your tongue, and that's just even your front tongue. But your dentist can be one of the first people that see that there's something that isn't right. So many dentists, and the good ones especially, will check under your tongue, will check around. They'll put your finger inside your mouth and just kind of feel around your gums. And you can do that yourself because sometimes these are silent. And so if you are brushing your teeth and you can feel under your tongue and between your cheek and your gums, and you feel that like there's a wart, because sometimes it feels like a wart, but it's not painful, that is usually cancer.
Is there any swelling involved? I mean, with your jaw or anything? No,
not
okay.
necessarily.
Okay.
The swelling that you do see is when it's already advanced,
okay.
and it's usually a lymph node that is swollen from your neck.
So, do you run like a higher risk if you have like reflux or anything like that, like the GERD or anything?
Yes, actually, reflux, or now the new term is GERD, but in the olden days it was heartburn or reflux. The reflux can be so devastating that it could reach even up to the nasopharynx. We have seen people have reflux so severe that it goes up into between your nose. And these changes give you something called Barrett's esophagitis, or changes or hyperplasia, atypical hyperplasia, which do irritate the lining of any of these parts, and they can produce cancer. It's a different cancer, and it's produced by a different method. But as you can see here, the trend is irritation. If there's an irritant, if it's not human papillomavirus, if there's an irritant, whether it's your dentures or whether it's smoking or whether it's reflux, if you start irritating something over and over again, it will turn on you.
Will head and neck cancers travel then, or go to the esophagus to create esophageal cancer?
No, they don't go down that route.
Okay.
They spread in a different way. They either spread through the lymph nodes, and the lymph nodes, we've gone through this topic before, but it's so important. The lymph nodes are a way of protection. They are a network that we have throughout all our body, and they're connected with lymph channels, and these are little, instead of capillaries or veins and arteries, they're lymph channels, and these lymph channels end up in a lymph node, which is like a train station. And there, if you have a floating cancer inside the lymph channel into a node, it should identify it and fight it. But if it doesn't know what it is, it sends it to another channel, to another lymph node. Think of it as, another train station, and so forth, and it starts spreading the cancer through the lymphatic system. It can go that way, or the second way, it can go through your veins or arteries into the systemic treatments and systemic failure, which would be, it would go into the lung, liver, the bones. Or thirdly, it can go into the surrounding structures. Let's say it started in the gums, and then it started growing, and then it invaded your tongue or the floor of your mouth or your bone or your cheek. And so it's the three ways it likes to spread. And so it can get so big, let's say if it started in your gums, that it will go into the bone and it will fracture your bone. And so it is a major, and the problem with these cancers, and I have to highlight this, Leanne, I cannot say it enough, is that imagine having something that does not spread but grows so large, it gives you the inability to even put your tongue inside your mouth, but you don't die. That is a problem.
Yeah.
So you have to go quickly. You have to treat these because they're highly curable. You don't want to let something that is curable get to an extent that it just gives you trouble, and it creates such a problem that is at that point not correctable.
It affects your life. It affects you're capable of having a full life essentially
for years, because you can live for years with a very large cancer.
Again, I'm with radiation oncologist and president of Central Care Cancer Center, Dr. Perez-Tamayo, and we've been talking about head and neck cancers. So, doctor, I do have a question for you. With head and neck cancers, can you lose one of your senses, like taste or smell? That's a
great question, Leanne, because this is another reason why supportive care is so important. We, in fact, put a tube in for support of eating, which is called a PEG tube or a percutaneous tube, into the stomach while we're treating almost in everyone. Because most people have issues with eating because their smell is not good during the treatment, or their taste goes away. Now, it does come back. But we eat, actually, why we eat is not only the taste buds, but the smell. If you do not have smell, not that food smells bad, but you can't, the aroma isn't there, it tastes like nothing, and then you have the issue of the pain of swallowing because the tissue is responding to treatment and it's dying, so you have the pain of that. You have the side effects perhaps of the chemotherapy and the radiation, so you put that all together and people don't eat. So this is a great question because it does take a lot of GERT, a lot of gut and perseverance to get through the treatment. even if you had a lot of help, because you have to sustain the pain. Although we do give pain medication, it's one of those areas in the body that it was meant to not be numbed, because if you cannot feel pain in your mouth or throat, we're meant to, it's one of the survival reflexes. So it's very hard to take away pain from that area, even if you get morphine.
Is speaking even cause some pain if you are being treated for head and neck?
Speaking can be difficult, especially if it's the vocal cords. And we recommend voice rest. The jaw gets swollen, and so moving it, there's what we call trismus, or moving it, opening your mouth becomes difficult. And of course, most of the people that have dentures cannot put their dentures in during treatment. Again, here's where people that have not taken care of their teeth come to confront their dentist, because if you have teeth that are not well taken care of, they have to come out. And that may be all your teeth. So, this is a big problem if you haven't been faithful with your teeth every 6 months, getting prophylactic cleaning and taking care of them. Unfortunately, when it comes to cancer of the head and neck, they have to come out if they're not in good shape.
Now, you had mentioned earlier, too, like tobacco, smoking, being a major risk factor, but that includes all tobacco products, like you mentioned, vape, as well as cigars, pipes, even chewing tobacco.
Absolutely. In fact, chewing tobacco and cigarettes hit you absolutely in the mouth and the throat, especially the vocal cords, but it's, it goes all the way to the lung, and that's much more prevalent in smokers than head and neck. However, the chewing tobacco, especially people that keep that wad in between the cheek, that's just like asking for trouble.
When it comes to HPV, you had mentioned that is, being another risk factor of such. Maybe explain just a little bit more about the importance again of that HPV vaccination. And
well, this is the sad part. You can prevent 80 to 90% of the HPV-borne cancers, which include the head and neck cancers, cervical cancers, penile cancers, esophageal cancers, and others, by just getting the vaccinations. And that includes adults, especially if you're a high-risk adult, meaning someone that already has immune compromise. So getting your children to be immunized, you just right there give them a very good chance of never hearing this again, especially if they're not smokers. And you don't really know about your partner, even if your partner has had one partner in the past, but they have HPV, you're going to get the HPV. Even if you both, have been continue to be extremely rigid in your marriage or your partnership. So you don't want to get the risk. So get vaccinated. It's simple. It's, like any vaccine, and it will take care of it.
What about occupational exposures, maybe? Do sometimes that runs a risk, too, for these types of cancers?
There are people that have more risk, and those are people that are doing secondhand smoking. The bartenders, for instance, even if they don't smoke themselves, they're getting the smoke of everybody's cigarettes. So yes, and people that actually burn any burning of any sort. People that work in certain mines, they have a higher risk. But really, to have a risk in the head and neck, you almost have to be ingesting it. And, that's not really more than what we have said.
Why don't we talk a little bit, too, about leukoplakia, which I have to commend myself every time I try to pronounce it, that I'm actually pronouncing it right. But it is a serious, topic, because it could be a precursor to cancers there in the mouth.
That's right. Leukoplakia is a precursor. It's a premalignant. It is not a non-malignant. It's a premalignant condition, which will lead to cancer. And it is telling you that there is atypia, or the cells have already gone into a transformed state and are going to lead into cancer, and it should be treated. Leukoplakia is something that can be seen mostly by people that are observing it, like dentists or, your doctor, your primary doctor in your mouth, or yourself. It looks like white patches. That's why leuko means white. and plakia means plaque. So it looks like white plaques. And you can see them on your tongue. It could be, mostly you see them on your gums, but also your inside cheek, your palate. These are the places where you see it most.
And we said, it's a precursor, so it's not saying that if you do see that type of white patch, it will automatically turn into cancer, but the risk there is pretty high, right?
It's extremely high. You're doing something causing this. So you have to not only stop that, but have that area removed.
I'm Leanne Powers with Dr. Perez-Tamayo from Central Care Cancer Center, and we've been talking about head and neck cancers today. And one other risk factor, doctor, I think that we should bring up, though, too, is alcohol, because it is up there as well with smoking and tobacco products.
Yes, and usually it goes together. They amplify each other. Alcohol could be very much involved in the head and neck cancer. It's not as common as other cancers down the road, like esophageal cancer, but certainly alcohol is one to mention.
The combination of having maybe not the best oral health and then smoking on top of it and drinking, I mean, it's almost like a recipe for disaster to some degree. But prevention for that would be just to simply check your mouth out or go to the dentist, to continue those kind of checkups, right?
Well, you can't take back your past. I mean, you can only do something now. You can't. To change your future, you have to do something now. So yes, number one is stop doing things that are irritating your mouth if you're already seeing the changes. But even if it's too late, where you have a cancer that is early, and even if it's late, get the treatment that you need, because it's highly curable.
Let's talk about that treatment. Like, how does that affect? Is there surgery involved in some cases? Is it mostly radiation?
No, surgery can be very much a major part of this, especially in the early cases. There's some where surgery is never really recommended because the loss of function is too great. Like, let's say if you have vocal cord cancer, to lose your voice box is a big price to pay, when we can treat it and get rid of it almost 99% without the need to remove the voice box. But there are cases in where debulking the tumor, meaning getting rid of the majority of the tumor, helps a lot, so that we can then the patient can then receive radiation and chemotherapy to do the rest. Now, there are some cancers, as I told you before, the location of the cancer really makes a very big difference as how it is treated. For instance, a cancer of the tonsil or nasopharynx is highly sensitive to the treatment of radiation and chemotherapy. So we usually never use surgery in those cancers, which are, back there. But if it's involving a bone, we usually do use surgery to stabilize the bone and to get rid of the cancer as much as possible. We don't do the radical surgeries that we used to do, although in some cases it is necessary. The nose nodes may or may not need to be removed. Mostly, if we can remove them, that's good. And so it really is it's on a one-to-one basis, and this is what makes it nice here. We have the ability not only to connect within our centers and have a telemedicine where we have a tumor board where we are discussing the case and have all our minds put into your particular case, but we can also connect with anybody in the entire United States, including other places. KU, for instance, we often have telemedicine where if there's something that is particularly special or different, or perhaps there is an interest that the patient has to get a second opinion, we can do that too.
What about when it comes to chemo? I mean, is it done orally? I mean, is there a case to be made for chemotherapy then too for head and neck?
Well, here again, depending on where it is and how extensive it is, there's different chemotherapy agents, and there's different trials that have shown different things. For instance, there's a recent trial that have shown equal results in giving weekly chemotherapy versus every 3 weeks. And for the people and other parts of cancers where traveling is a big problem, perhaps that's a part of the equation we have to put into the treatment. How far do you live? How difficult it is to get here? And what the difference the risks and side effects, because you can imagine that if you give a lower dose weekly versus a higher dose every 3 weeks, you may have less travel, but maybe more side effects. So you have to take all into consideration. And if you are older and perhaps cannot take, a lot of medication that would, and especially if you live alone, that would make you unable to take care of yourself, well, then you really need to consider doing it in a more gentle way. So the chemotherapy and radiation most of the time is given together, although sometimes we do something called neoadjuvant chemotherapy, where we actually give the chemotherapy first, shrink the tumor, and then give the combination. There may be even immunotherapy involved in some cases, it's a pill sometimes where you are given a maintenance treatment afterwards. And there are many studies that are ongoing which are showing more and more immunotherapy results showing positivity in treatments of these cancers, where there's actually mutations that can be seen in the pathology, which will respond, the different cancers will respond to the treatment by these new agents.
Bottom line, as far as the screening goes, get to your dentist regularly, and you can check your own mouth out, for, like you mentioned, cold sore kind of looking, spots if they've been there for a while, because like we've mentioned before, your quality of life is fuller if you can, catch this early.
Absolutely. Dying of a head and neck cancer is really a very difficult death. And it's something, why would you want to go there when it's highly curable?
And I also think, too, as far as any kind of way to lower your risk or to prevent, this type of cancer, is just to monitor yourself when it comes to those extracurriculars of smoking, possibly tobacco products, alcohol as well, correct?
Absolutely.
And visit the dentist regularly. He wants to see you, too, every once in a while. Thank you, Doc. Do you have anything else you wanted to add, maybe, about head and neck?
Well, no. It's just that I think that many people don't know what to do when they find something, and we are more than happy to see people if they want to show us a lesion. A lesion means an abnormality in the mouth, in the tongue, and you can come in, make an appointment, and we can say, this is nothing to worry about, or yes, I think we need to look at this more closely. So don't be afraid to come in, just even as a way of finding out what the problem is.
That sounds great. Thank you, Dr. Perez-Tamayo. Well, we appreciate you taking the time to listen to Cancer Explained with Central Care Cancer Center. With facilities throughout rural Kansas and in Missouri, Central Care offers complete cancer care, all under one roof, so there's no need to travel far for the best care. Whether you need radiation or chemotherapy, access to clinical trials and novel treatments, maybe financial counseling or other supportive services for yourself or your family, even a second opinion, Central Care is here for you. You have a choice. Bringing that expert care to you is an important component to the success of your outcome. Being surrounded by your family, your friends, that can be the factor that elevates your treatment. Feel free to reach out by calling 800-592-5110, or you can visit us online at cccancer.com. For Dr. Perez-Tamayo and all of our amazing providers and nurses, I'm Leanne Powers. Thank you for listening to Cancer Explained with Central Care Cancer Center.
You've been listening to Cancer Explained with Central Care Cancer Center, offering expert cancer care that's close to home. Central Care Cancer Center has clinics throughout Kansas and in Missouri. Central Care Cancer Center, online, cccancer.com.